Hello everybody, welcome to my channel. This is a pathology video on respiratory pathology. It covers the topic etiopathogenesis of tuberculosis. This is by Dr. C.S.B.R. Prasad, Professor of Pathology, Sri Devarajaras Medical College.
Hello students, today we are going to deal with tuberculosis. By definition, tuberculosis is a chronic granulomatous disease which is communicable and caused by Mycobacterium tuberculosis. Site, it can affect any tissue in the body, but most commonly we encounter disease affecting the lungs and lymph node. So it spreads by airborne droplets, and 80% of us are infected by tuberculosis, but many of us may not suffer from tuberculosis. So 50% of world's tuberculosis cases are in our country, and this is the leading cause of morbidity and mortality in our country. Since the beginning of 20th century, there is a dramatic decline in tuberculosis due to control measures that are taken to contain the infection and BCG vaccination and effective drugs that are developed and education. And however, after the emergence of HIV, tuberculosis has become a rampant problem everywhere in the world. The causative agents of tuberculosis is Mycobacterium tuberculosis hominis, Mycobacterium bovis is unpasteurized cow's milk is a source for this, and Mycobacterium africanum, which are mainly seen in the case of natives of Africa. And others that may produce similar picture is atypical Mycobacteria and My complex. Most commonly it is seen in immunocompromised individuals. Causative agent, that is Mycobacterium, are obligate aerobes, that means they require oxygen for their survival, and they exhibit two properties. One is the acid fastness and their then alcohol fastness. They can resist decolorization by 20% H2SO4 after staining with carbon fusion. And this acid fastness is due to complex lipid that is present in their cell wall. So this is the important point that we should get here is the acid fastness and the alcohol fastness of the tuberculosis bacillus. So you'll be using this property to identify these bacilli under microscope in our labs. So predisposing factors: poverty, overcrowding, chronic debilitating illnesses, elderly persons, and some American blacks or Indians are highly susceptible for, especially Paima Indians are highly susceptible for tuberculosis. And other important practical aspects are those persons who are suffering from diabetes mellitus, and those are on steroids are highly susceptible for mycobacterial infections. So a long-standing diabetic, when he develops cough of longer duration, which is not responding to antibiotic therapy, think of the possibility of tuberculosis in that person. And pathogenesis of the organism depends upon the virulence of the organism and development of the sensitivity and immunity in the host. And virulence depends upon the presence or absence of cod factor, which is known as the trehalose 6,6 dimycolate. And this is the structure of that cod factor, which causes the cod formation of mycobacteria in cultures. And pathogenesis, the exposure to tuberculosis is associated with the non-specific immune response to start with, and in the course of time the patient or person develops delayed hypersensitivity reaction, which results in granuloma formation with caseous necrosis. So to elaborate more on the this pathogenesis, the bacilli will be phagocytosed by macrophages, processed, and presents the antigen to T helper cell. So this interaction between the macrophage and T helper cell ultimately results in the production of an sensitized TC cells or cytotoxic T cells. And these cytotoxic T cells releases lymphokines, which are responsible for recruitment of more lymphocytes, more macrophages, and also it stimulates the macrophages to become more efficient in killing of the bacilli. And these transformed macrophages, which are efficient killers, are known as epithelioid transformation of macrophages or epithelioid cells, which are the constituents of granuloma formation. So macrophage migration inhibition factor, macrophage migration factor, and interferon gamma are responsible for this activation of the macrophages, containment of macrophages, recruitment of macrophages to the site of infection. And the macrophage with enhanced phagocytic activity and bactericidal capacities are known as epithelioid cells, and they are efficient killer cells. And what you should know regarding tuberculosis is it is an intracellular pathogen, and to kill or neutralize intracellular pathogens, our body depends on cell-mediated immunity. So, wherein the T cell participation is very important, and it is associated with liberation of cytokines, which in turn stimulate the macrophages, make them to become more killer cells. And ultimately, these macrophages, or which are called as epithelioid cells, secrete many catabolic enzymes which destroy the cells. So these destroyed cells will become powdery, and which can be appreciated as powdery type of necrosis under the microscope called as caseous necrosis. So there are two types of patterns of infection with the tuberculosis. These two types are distinguished depending upon the sensitization of the individuals. Say, for example, in the primary tuberculosis, the person is getting exposed to tuberculous bacilli for the first time, and there is no sensitization of the immune mechanisms in the person. Secondary tuberculosis is the person's status is already sensitized to tuberculosis. That means he got exposed to tuberculosis to start with, and the second infection may be associated with the activation of hypersensitivity reactions, which results in different manifestations in these persons.
Thanks for watching. Please subscribe by clicking the button subscribe.